Hypertension causes, effects, and management. Ever wonder why they call hypertension the silent killer? It's because most folks feel just fine, no pain, no red flags, and no clear signs. But deep down, your body might be taking a hit. Today, we're going to dive into what hypertension really means, its impact on your organs, why it's a serious concern, and most importantly, how to keep it in check. Let's kick things off. What is hypertension? So hypertension is just a fancy term for high blood pressure. Blood pressure is basically the force of your blood pushing against your artery walls. Ideally, you want your blood pressure to be around 120/80 mmHg. If it's consistently above 140/90, then you're looking at hypertension. Now, picture this. Your blood vessels are like flexible pipes. If the pressure in those pipes stays elevated for too long, the walls can get damaged, become stiff, and thicken. That's when the trouble starts. What causes hypertension? There are two main types. 1. Primary essential hypertension. This type creeps up on you over many years. There's no single cause for it. It's often tied to genetics, being overweight, high salt consumption, stress levels, not getting enough exercise, aging. This is the most common form. 2. Secondary hypertension. This type is caused by another health issue, like kidney problems, hormonal imbalances, certain medications, complications during pregnancy. How hypertension harms the body. Let's break it down by organ. When your blood pressure is high, your heart has to work overtime to push blood through those narrowed vessels. Over time, this can lead to thickening of the heart muscle, left ventricular hypertrophy, weakening of the heart failure, increased risk of heart attacks. The heart gets worn out, and when it fails, the whole body feels the effects. High blood pressure can harm the blood vessels in your brain. It can result in strokes, memory issues, vascular dementia. Mini strokes, TI, is if a blood vessel bursts, it can lead to bleeding in the brain. If it gets blocked, the brain cells don't get the oxygen they need. Either way, brain cells can die off. Your kidneys are responsible for filtering waste from your blood. They rely on healthy blood vessels to do their job. Hypertension can damage the tiny vessels in your kidneys. Over time, this may lead to chronic kidney disease, kidney failure, needing dialysis. Many people with kidney failure have struggled with uncontrolled hypertension for years. Eye health. High blood pressure can harm the tiny blood vessels in your eyes. It might lead to blurry vision, bleeding in the retina, loss of sight. Sometimes changes in your vision can be the first clue that something's off. Blood vessel damage. Hypertension can hurt the walls of your arteries. This can result in hardening of the arteries, atherosclerosis, decreased blood flow. Higher chances of heart attacks and strokes. The vessels can become rigid and narrow. Why it's known as a silent killer? Because most folks feel perfectly fine. There are often no noticeable symptoms. Some might experience headaches, dizziness, nosebleeds, but many people feel nothing at all. That's why getting your blood pressure checked regularly is super important. Managing high blood pressure. Here's the good news. You can manage hypertension. It might not always go away completely, but you can keep it under control. And managing it means living a healthy, normal life. Let's dive into how to do that. Cut back on salt. Too much salt makes your body hold on to water. More water means more pressure in your blood vessels. Try to reduce processed foods, instant ramen, packaged snacks. Extra seasoning cubes. Go for meals that are low in sodium. Keep a healthy weight. Extra body fat puts more strain on your heart. Shedding even 5 to 10% of your weight can really help lower blood pressure. Every little bit counts. Get moving. Aim for at least 30 minutes of moderate exercise. Brisk walking, dancing, biking, swimming. Working out helps make your blood vessels more flexible. It reduces stress hormones. Plus, it strengthens your heart. Eat for your heart. Focus on veggies, fruits, whole grains, lean proteins, healthy fats. Steer clear of fried foods. Too much sugar, excess red meat. Remember, food can be your medicine. Watch your alcohol intake. Drinking too much can raise your blood pressure. Moderation is essential. Quit smoking. Smoking harms blood vessels right away. It raises the risk of strokes and heart attacks. Kicking the habit can improve your circulation almost immediately. Manage stress. Chronic stress increases blood pressure. Try deep breathing, prayer or meditation, adequate sleep, taking breaks. Your nervous system needs rest too. Monitor your blood pressure. Check regularly, especially if you are above 40. Have family history or overweight. Early detection saves lives. Take medications as prescribed. If your doctor prescribes medication, do not stop it suddenly. Common types include ACE inhibitors, calcium channel blockers, diuretics, beta blockers. They work in different ways to relax blood vessels or reduce fluid. Medication plus lifestyle change works best. Regular doctor follow-up. Hypertension is a long-term condition. You need monitoring. Adjustments may be necessary. Do not self-medicate. Before and after management. Characters. Scene idea. Before management. A person looks tired, frequent headaches, swollen legs, breathless, high blood pressure reading. Internal organs under strain. After management. Person looks energetic, blood pressure reading normal, heart working efficiently, vessels relaxed, organs protected. Same person, different outcome, because of control. Final message. Hypertension is dangerous, but it is controllable. You may not feel it, but your organs feel it. Start today. Check your blood pressure, reduce salt, exercise, take your medications, protect your heart, protect your brain, protect your kidneys. Because prevention is always better than emergency.